going to talk about what you've told us that you want to hear about. That'll make your caregiving journey a little bit more enjoyable and a little bit easier. And I have Lynelle Drudge on the line with me today. Hello, Lynelle.
Hi.
Hi.
Hi, Dr. Diddick. How are you?
I'm awesome. Thank you so much for joining us. Lynelle, we'll tell everyone a little bit about you and why you're here. Our topic today is navigating the system. So where do I go when I need to know? And Lynelle, your job title is the First Link Care Navigator, right? You are a navigator.
That's right.
You're a social worker, and you work at the Alzheimer's Society. So, some of our caregivers aren't working with someone or caring for someone who's living with Alzheimer's, but a lot of the things that we want people to know about navigation are pretty common. So what is health system navigation?
Okay. Well, navigation is basically what's in the title, navigating through the different health systems or the different support systems that may be helpful to you. What I hear with my own clients and some of the research that has been done is that what we're hearing from care providers is that it can be very overwhelming, it can be stressful, it can be confusing, in trying to keep track of sorting through the different support options that are out there. And so what my job is, other system navigators is to just walk alongside clients, hear what the needs are, provide them with support options, perhaps help them make the referral or the contacts. It's individualized, for the care provider. So it just depends on what they need, but it's walking alongside with them, connecting them to the supports in the hopes of decreasing the stress and the feeling of feeling overwhelmed.
That sounds so valuable, because you're right. Like, being a caregiver is a pretty heavy job, even when it's going well. So getting into overwhelm is really hard. Yeah.
Right. It's not only, on top of that, trying to connect with the system, they're also trying to provide the support and care for their family member too. So it is it can be a stressful role.
Right. Sure.
A changing role.
Yes. And ever changing. That's part of it. And you mentioned that. So the range of choices. So in some ways we're very lucky that there are those choices, but navigating it, finding out what's right for me. And so what is often the first step when, how do you know you need a navigator? And what would be your first step, do you think?
I think it can be a couple things. Knowing that you need a navigator, for some, you may just feel not aware of what supports are out there. That feeling of, I'm feeling overwhelmed, I'm feeling stressed, I don't know who to contact, I don't know the supports out there. So what we encourage, and I would recommend to any care provider who you're caring for, is to contact or be in touch with the agency or the society, of the person you're caring for, whether it's the Alzheimer's Society or Parkinson's or arthritis or whatever it is.
Right. Autism or developmental disabilities or cerebral palsy, whatever.
It does whatever it is to be in touch.
It kind of does spring a bit from a diagnosis, right?
It does.
It's helpful then to have that diagnosis. And I know, for thinking about your role, it's called First Link Care Navigator. So we get people into navigation oftentimes right at diagnosis. So you don't always want to wait till overwhelm, right?
No, that is for sure. And in fact, we recommend, as soon as the diagnosis happens, or even sometimes before, if there are concerns there, to still contact us, because again, it's been proven that the earlier the contact, the better one fares. You're starting off more on a positive foot with the caregiving role. Okay. And once one reaches out to that society or that supporting organization. Search out what resources do they have, both for the person you're caring for and for yourself as a care provider. For that, can they help navigate? Is there a social worker or a supporting person to help navigate through that, through that system?
Yeah. And what would that look like? So you mentioned taking the person by hand and guiding them through the system. Mm-hmm. Is that literally, like, would there be a face-to-face meeting, or like, how does that navigation actually occur?
It can be face-to-face. We do both face-to-face. Really probably is going to depend on the organization, but yes, face-to-face. Usually it starts out with some information gathering, because we have to hear the story, have to know what the concerns are. Mm-hmm. So we kind of walk through the diagnosis, the different dynamics, what type of care that, there is. It's also helpful to know if you're receiving any other type of supports, because we're usually not just the one. We are part of a whole picture, mm-hmm. And sometimes the other circle of care or those other agencies who are providing support kind of coordinate with each other, so we're not duplicating services either. We work together to give that whole picture, that whole support that's possible. So it's that information gathering, and once that's done, then we will, once we know what the needs are, then we can let you know. It can be in resources, it can be referrals, again, just whatever the need is. It's pretty, for us, I know it's pretty much client driven. So some people prefer an in-person meeting, and other people, a phone call is okay. Again, because needs are different, the intensity is different. And so we take into the uniqueness of each individual and each care situation.
That sounds good. So it sounds like a navigator is there with you to kind of guide you through the system, take off some of that pressure of making decisions about that, because you've been around the block a few times in the Alzheimer's world, for example, right? So you know what's worked, what doesn't work, and where to go. Yeah. So the navigator does that. Mm-hmm.
There can also be advocacy too, depending on, if the caregiver has a little bit of difficulty expressing the needs, or may not feel quite comfortable in really putting out there what they're needing and what they're feeling. Then as a navigator, we can advocate for that other supporting agency or different support in helping to advocate and help to receive those supports.
Okay. So can you give me an example of that, like where the advocacy might come in?
It can be, I have advocate, with different community agencies, before they maybe just didn't understand a certain program, that was going on, or maybe they wanted some supports they didn't just know how to reach or felt they needed more. So I would, I have contacted different coordinators just for clarification, or maybe just to explain a bit more, what the needs are, at least what expressed.
That sounds good. So the navigator might,
sometimes we talk.
Yeah. So as the navigator, you might sort of make some of those calls. Like you might talk to the client.
Right.
And they would say, oh yeah, that we didn't think that day program was for us. So you might say, well, let me call the director. I know that director. And then you might just clarify and then be able to re-engage.
Yeah, that's right. I mean, it could, maybe they didn't quite understand the program, or maybe they didn't, or sometimes they feel they might need more in-home supports, perhaps through the Lynn or some community agencies, they don't quite understand, what's really available for them, and maybe doesn't think it's for them. Then, again, you can call that agency and, get clarification, what type of programs do you have to offer? These are kind of the needs. Can you support that? And if they say yes, then we go back to the client and and then can further explain how that agency may meet that support. And then if consent is obtained, then we can make that referral,
Right. Right.
Yeah.
And so that's good to know for people to know too, probably who are listening, is that when you share information with a navigator, that's usually, is that treated sort of like personal health information? Like it's treated pretty carefully and
Oh yeah, no, it is, it's confidential. There can be some sharing, with a circle of support, but in my case, I always ask, the permission for that. It is confidential. And we, in talking with clients, we come up with a plan. We come up with a plan together. So part of that plan may be, in agreement that I would call or advocate for that person. So it's a plan that's made together with their consent, for sure.
That's really good. Yeah. So, I mean, it sounds to me like a navigator is a great person to kind of have on your team, and would be very, kind of what I'm hearing from you is it's very flexible, and it's very much like in response to what you need and when you need it.
Yeah. And working together to do the care plan. Supporting them. For that. And encouraging them to take what they can. I mean, it's not doing everything for the care provider. It's probably more empowering. It's walking alongside and empowering them, to help manage that role.
Yeah. And then once you've made that connection with your navigator, I guess that's the thing too, is that person might be your one-stop connection. If you have a navigator on your team, you might say, even after you're connected with the program, is that possible too? Like you might say, oh gosh, I can't remember who was running that program. Was that part of the Lynn, or was that part of Community Support Connections? Oh, I'll just call Lynelle and she'll tell me. Does that ever?
Yeah, and that's right. That's right. And I should mention too, we talked a lot about referring out to different programs outside the agency, but I also navigate within the agency too. So we do, of what type of groups, what type of education, what type of activities may be possible. So there's a lot to balance, a lot to coordinate. And so you're right, it is that one-stop shopping, because they have that one person. In fact, I had one client tell me they were so overwhelmed with what was out there. They said, just give me one person I can talk to, just one person that will walk me through this. And I said, well, you're talking to them.
I'm your gal.
Yeah. So, and that's for sure. So it's that one-stop shopping and coordinating both outside the agency and within,
Really good.
And recognize too that I'm kind of assuming, I only work with the Alzheimer's, but I'm assuming it would be with other diagnoses as well, is that it's just not a one-time navigation, because as months go on, as years go on, things change. If the diagnosis is progressive, things change, so the needs are going to change over time. And so there is usually, with us and probably with others, there is continual follow-up with that person. Because of the changes that can happen. So it's always that checking, with the person, how are things going, what's needed now, and kind of a reassessing, what the needs are.
Oh, that's excellent. So it's not, so people don't have to worry that they're going to get suddenly discharged or run out of visits or run out of money, or, that's so comforting. Yeah. It sounds so good.
And again, there's always that care plan of working together. If there is a discharge that happens, it's a decision together, with that.
Excellent. Wow. Well, that's a great summary of what a navigator can do and what the navigation part is. And I think the first thing is being open to having that navigator.
That's right.
You've got to kind of say yes to it.
You have to be willing to reach out because we don't know who you are, you know, so unless a referral is made. But yeah, I cannot encourage enough to just reach out and just make that phone call. You know, once you make that phone call, take it from there.
Yeah.
You know,
yeah.
But it is just reaching out and giving that call, you know, and reaching out.
Yeah. And I know, like, so I'm a geriatrician, as I mentioned, and we do make referrals to First Link at the Alzheimer's Society, and we do get a person's permission to do that. But once they give permission, that opens the door. And then, of course, you have to answer the phone when the phone call comes in, and, you know, but that really opens the door to a really good relationship and very helpful.
Yeah, for sure.
Yeah. And the people I notice that embrace that navigation usually, it takes a lot of the pressure off.
It does. Oftentimes, and you can even sense during the phone call, you can just feel the pressure being released. And I think a big part of it, what my sense is from clients, is that not so much what is being said, but just that contact has been made. You know, because once that contact, they know they have the support, and that's just very comforting and reassuring. You know, for people. Yeah.
We could use navigators in lots of areas of our lives.
Oh, yeah. Oh, for sure.
But the caregiving part is an important one.
But the main thing, again, I think one thing to just know from that is to reach out. That's just the main first step.
Yeah. Even if you think things are going okay, just reach out and see what's there, and, you know, have that number.
Exactly.
Because then you have that number and you can keep it in a place where you might need it. You might not need it this week, but next week or next month, you might be calling and be there.
Exactly.
You won't have to start all over again. Yeah.
Yeah, exactly.
And the navigator knows your story too, so you don't have to rehash everything, right? If you're working with a navigator every time.
Yeah, that's right.
Yeah, that's a big thing.
Yeah, that's right.
Good. Well, thank you, Lynelle. I knew that you would navigate me through this topic, and you would navigate us through this very important thing to talk about today. But yeah, thanks again. So we were talking with Lynelle Drudge, who is a First Link Care Navigator, and she is a social worker. And she was talking to us today about the importance of navigation, what it is, and why you should reach out for it when it comes your way or when you need it. Yeah. Thanks for joining us today, and we'll see you again soon.